I've always found alcoholics, I have very mixed feelings about dealing with alcoholics. On the one hand, they don't have a mental illness sometimes, but on the other, they can be bloody awkward to hook in.
Mm-hmm.
How do you find that?
I suppose that's part of the reason that I enjoy dealing with, if that's the right word, dealing with alcoholics, because they don't have a mental illness, and they're quite the nearest thing I find to ordinary people, which is unusual in our business. We don't see that many ordinary people, but here we see, I think, ordinary people with alcoholism, if you like, grafted onto them. Now, the majority of they have similarities with psychiatric patients, because many of them, in the initial stages, won't have what could be called insight, but not insight in the mental state. Insight insofar I don't need help. I know I drink too much, but I don't need help. Except the wife has dragged them along, or the two children who are very fed up with dad the way he is. It hasn't yet got to the stage where the boss is waving a finger at him, but everybody knows that Bill has been drinking too much. And of course, because their mental state alters with the amount of alcohol taken, when they're not taking alcohol, they're pleasant, as I said earlier, ordinary people, and one has an immediate set of what one's trying to aim at.
And what tricks do you use to hook them into treatment?
Trick isn't quite the right word. I think what I do is I spell it out to them. So one presumes that they've got as far as me, which is many of the hurdles already overcome. You can imagine that the spouse has had a go at them, probably the boss has had a go at them, possibly even lost a job by the time they get to me. Some of my work is almost done for me, but we've still got a very reluctant patient usually, and usually a very frightened patient, because they know what they're like without a drink, and they can't envisage being without one. So from that time, I spell it out, and I say, the first thing you hear is, well, I'm not an alcoholic. And then the smarter ones will say, what's your definition of an alcoholic? And then I think you're suckered into the intellectualization of what's going on. And I have a very, very simple definition. An alcoholic to me is synonymous with too much drinking that interferes with anything. And that starts with the relationship with your spouse, your parents, your work colleagues. You're already not reached missing time out of work. I'm slow back to after lunch. I mean, these are the things that we always see. And of course, I'm only talking about usually men in this. It's a different setup with women. But I think one's got to almost focus different groups.
Can I just pick up on that? You say that men and women are very different with this. What do you think of the differences?
Well, I think male drinking culture is much longer established, and therefore I presume more acceptable. And the female drinking culture is apparently new. I think the younger people say it's not. We know that the girls now go out and on the town just like the boys do, but it still doesn't get as far as me quite as often. I'm seeing quite a number of the established alcoholics, which are the sort of middle-aged men, nowadays commonly the younger men, the middle-aged women, but the young women haven't quite got there yet. And I'm not quite sure about that. I think it's possibly because there are other substances involved.
So tell me about middle-aged women. You say they're not the same as men.
I find that the middle-aged women tend to drink as a symptom reliever. Now maybe it's because one tends to look more closely at middle-aged women, or you get a chance, because they're often further down the line insofar as the men haven't noticed that their wives are drinking, because they also leave early in the morning, come back late at night, and, well, she could have drunk her bottle of vodka and slept it off by the time he comes in. And when he comes in, she'd say, "Would you like a glass of wine, darling?" And he said, "Of course." And she'll take her glass of wine as if it's the first drink of the day. And frankly, some of us are not so good at spotting that our wives have been at it all day. So they get further down the line and often come in a more parlous state than the men do, because they don't have the same support systems that men have. So they'll have liver damage, and they'll have muscular damage, and they'll possibly have brain damage, and they'll have broken the odd limb, just like men might.
Changing the subject a bit, describe for me a typical day in the life of an alcoholic.
Well, the day starts terribly early, and I would have thought it starts for a typical male alcoholic, if there is a typical male alcoholic. But the guy in his 40s will be waking up in the small hours of the morning, and he'll be sweating, and he'll be shaking, and he'll possibly have his bottle of whatever whiskey by the side of the bed, and he'll put his hand out, and he'll have a little swig while the good lady is asleep. That's if she's still able to bear it in the same room. And eventually he'll come down at 6 o'clock, and the tremulousness will still be there, and he'll decide, "I better go and tidy up," because he'll be looking very rough. And the toothbrush will shake in his mouth, and he'll be wretching, and you'll have heard of dry retching. When the first drink they take, they vomit. But they'll get it in eventually, and they'll settle down, and they'll gradually work their way through whatever their tipple is. And often, if they're working, it might be vodka. And when you first see these patients, they'll say to you, you'll ask them how much you're drinking, and they'll say half a bottle of vodka a day, as if it's an enormous amount. And I'll probably say something rather like, you get through half a bottle by 10 o'clock in the morning, I would have thought. Not too difficult. You buy half bottles because they're flat, and you can't, and they're more easily concealed. And you'll get that done by 10 o'clock. You'll have a couple of swigs over what used to be breakfast, but you don't eat your breakfast because you're gagging, and you've got a central appetite suppressant effect of alcohol. And then you've got a bit of gastritis as well, because your gut's bloody sore, not to speak of your liver that's aching a little bit. And then you'll make your way to work with either another bottle in the glove compartment or not, and you'll top yourself up nice and steadily through the morning till it comes lunchtime. And then, of course, you're watching all the time, and instead of going to lunch at 12 o'clock, you'll be out at 20 to 12, and you'll be down to the pub, and you'll tipple away whatever you can. And instead of coming back at 2, when everyone's meant to, at 2 o'clock, you'll come back a little bit later. And if you've been smart enough to get a rather senior job, you'll be able to have a sleep at your desk with all your minions protecting you. He's in a meeting until 4 o'clock. And then he'll come home, if he eventually comes home, about 9 o'clock, and he'll have topped himself up on the way. And he'll come home probably irritable because he's got to come home at all. And he wants to stay out drinking, but he's going to have more trouble with his wife or whoever else. And he'll start a row. And he'll want to know why his supper is cold or dried out or whatever else. And probably throw it across the room if he's one of those types. And then you can imagine the fracas before he eventually settles down with his last bottle of vodka before he collapses to sleep around midnight, just to wake up again around 2 or 3 and start again. Got the picture? That can happen. And I think that's what does happen. There are other people who binge at weekends. And the obvious question of that is, when's your weekend start? And it starts around Friday lunchtime and ends on Monday morning. I'm going to tell you a little story which is absolutely true. I arrived in Ireland and was asked by the taxi driver, have I got an interest? He knew he was collecting a doctor. I said, yes. I said, I'm very interested in alcohol. And he said, so that's not fun. So am I. I said, and I asked him, I said, do you take a drink? He said, yes, I take a drink, but only at weekends. And I said, as one does, when did your weekend begin? Well, it begins around Friday. I said, and what will you get in between Friday and the time you go to bed? Well, I'll go down to the pub and I'll probably manage about 15 or 18 pints spread out over between, 1 o'clock and midnight. It's not so many. I said, yeah, and what about Saturday? Saturday's a good day, he said. I can start around 10. And I worked it out that he'd have about 20 pints, 25 pints on Saturday. And of course, Sunday was a better day because there were more people around, and he'd drink until he'd have a sleep in the afternoon. But I worked it out that he probably got through about 60 pints from Friday lunchtime until Sunday evening. So of course I asked him, I said, but what about Monday? I said, you must be shaking and tremulous and uncomfortable with gastric pains. And I said, I am. I'm dreadful. I said, well, how do you get to work? Well, I'll have 2 pints around 11 o'clock and 2 pints around 3 o'clock and 2 pints. I said, I thought you said you only drink at weekends. No, well, I'll do the same on Tuesday, Wednesday and Thursday. I said, but that's another 30. So you wouldn't call that a drink, would you?
Tell me about detox.
Well, I believe it's impossible and unhealthy and dangerous to attempt detox at home. You're asking an addict who is really trying to drink to couple it with pills or replace it with pills and not run risks. And frankly, I'm sure it's all to do with the resources. Under an ideal world, everybody should be detoxed in a hospital setting, regardless of the degree of detox that's required, because detox in itself is quite a dangerous procedure, and people can get pneumonias and various things, gastrointestinal trouble. So I like to do it in a hospital setting. I use one of the tranquilizing sedatives, usually Librium, can be chlormethiazole. I think the theory of chlormethiazole years ago was that there was an element in it that was like thiamine. So they used chlormethiazole. And it's very easily titrated against the level of arousal that the person in detox experiences. But some people think it's highly addictive. That hasn't been my personal experience. So one brings them into hospital and one replaces the alcohol with usually chlormethiazole or Librium. And to make sure that they don't enter into DTs or have a fit, we will couple it with an anti-epileptic drug such as carbamazepine. We will replace and protect against hypothetical Wernicke's and Korsakoff's, giving vitamin supplements, and make sure they have a night's sleep. And I tend to use the longer acting diazepines for that, because if there is a lag effect into the morning, it often suits the patient. And they generally have what I consider, I think, a comfortable detox.
How long does a detox go on for?
At least, I would have thought, 7 days, to remove them from the alcohol and then, of course, remove them from the pills and give them a chance to sober up in a much broader sense, whereby they can begin to take stock of their situation and recognize while they're in here. In the initial stages, I imagine, simply to relieve them of the physical problems that are associated with alcohol. But I think if you can keep them a little bit longer, you begin to see that there is more to be done.
When you say more to be done, what sorts of things?
Well, I suppose one's got to start thinking, how do we minimise the risk of them restarting drinking again? And in my experience, and I think the research shows it, that a time spent in a hospital setting away from the various pressures that may have contributed to the excessive drinking is beneficial. You can begin to imagine how many social, personal, familial pressures that are present outside the clinical setting. So you can tend to bring them in, protect the patient, and allow them to begin to think for themselves. Also, they meet, dare I say it, fellow travellers. And fellow travellers in a group setting are very, very helpful, because they constantly remind the patient of what might be, what has been, and frankly they don't stand any bull from them. They know where they've been, and I think that's very helpful. And you've got the cohesiveness of a group that have shared experiences. So I think the alcohol recovery group is the most important weekly event. It's easy for our patients in the Cardinal Clinic to attend because they've travelled the same road. Many of our patients find AA difficult to take, and there are various reasons for that. I think the medical input is important in the early stages, and I like to use a colleague psychotherapist, usually of a different gender, because people relate to different people different ways. But I think the research shows us that the most significant thing is the regular contact, and it hardly matters whether it's a doctor, a priest, a therapist, or a group, once they can maintain the continuity. And I find that patients are more inclined to continue to attend in a group setting.
And how long do you think they need to attend for?
There's very little research on that. I would have thought at least weekly for 6 months, and then maybe they'll move on to monthly for the following 6 months, and then probably think again. There are certain periods of vulnerability in people who've been withdrawn from alcohol, and I think again it's virtually, there are three that I think of. One is virtually when you leave the clinic. The first few days, people are very vulnerable. And the next period is around 8 weeks of sobriety, plus or minus a week. And the next vulnerable period is around 20 weeks, plus or minus a couple of weeks. So it's very important, I think, knowing that, to extrapolate from the cohort of the research to try and recognize these vulnerable periods and intensify one's efforts around those times.
Why do you think people are vulnerable at those times?
I've no quick answer to that. I suppose it's one, they've never wanted to give up at all, and everybody else has been pressurizing them, so they go out and they'll start drinking relatively quickly. Their motivation's very weak. Another thing that happens in the early stages is that their cognition, their judgment isn't good. They're already damaged, and an awful lot of what's gone on in the therapeutic process has been frankly lost to them. And then I suppose at week 8, as I said, 7 or 8, it's probably an arrogance. I've licked it now, or I'm tired of resisting it. And I think similar things happen at around week 20.
I see increasing number of, dare I say, sort of middle-aged women coming in who've been drinking. Do you think there's any sort of special features about them?
Well, yes, but where it's coming from, I don't know. I think women have learnt that alcohol is a very good short-term therapy, and one often finds that with women, they are combating usually social phobias, particularly panic syndrome, depressions. I say that because I believe they're less influenced by cultural drinking than men. Therefore, they're finding that they can use it as a medicine, and it works terribly well in the short term. So I think that happens. I think some women get very depressed, and they are at home alone, or sort of alone, and they'll find that it's pretty good pick-me-up. And I suppose the sherry of yesteryear has been swapped for port, which has now been probably swapped for bottles of vodka, and some of the more modern drinks that are taken.
What sorts of things should we be on the lookout for?
I think they drink in a more isolated fashion and come unstuck. Probably, I don't say more often, but as doctors we see them unstuck. In other words, they've lost their license. On their way to pick up Billy from school is very common. They've got bruises, and it's because they've fallen over, and there's a coagulation effect, and their liver have been affected, although they'll say it's the husband, and it might be the husband trying to shake them sober. They present more acutely, as I understand it anyway. If you get a referral of a female alcoholic, you'll be pretty sure that there's something happened. Whereas with the men, it's insidious, I think.
What about the way they go about drinking? Where do they get their drink from?
The weekly shop, I think, is what they do. They lose it in the big till roll of all the other things. Some of them are rather shamed by it, so they'll go to the off-license that isn't around the corner. And many of them will have a stock-in secreted around the house in all the various places that people secrete bottles of booze. Bread bins, wardrobes, toilet cisterns, bin bags, the bottom of the bin. Just depends on your imagination, really, where you hide it.
What do you think of the sort of social consequences that some of these drinkers...
Yes, I think it's the most malignant of all our addictions. I think it's devastating on families. It destroys marriages. It ruins children.
What do you think is the outcome of treatment?
That's also very hard to quantify. And we only see the ones who get better, I suppose, and then go off into the sunset. How long they stay better, I'm not sure. But I think around 30 to 50% will do well.